I want to talk about your heart attack. I want to talk about your 30, right? Did you had your heart
Mm-hmm.
attack at 30?
Right
Wild.
after I turned 30.
What what
Uh,
yeah, like physically what was going on? And like I know you see it because that's how we roll. It was like it's something more than just the heart attack, right? But like what
mm,
physically happened, what was going on, and then yeah, tell us that story.
Wild story in hindsight, right? If only our foresight was as significant and impactful as our hindsight. Uh, my background is in preventive cardiology. So through school, I worked with inpatient, outpatient physicians and patients to help with preventative health measures to help people before they have a heart attack. Like what markers can we find? What type of physical activity can we recommend? What type of stress coping mechanisms? And so me having a heart attack was never in my cards. It was probably early May. I got bronchitis out of nowhere, um, probably through cycling and being around people, or maybe just being in social settings. And so I took time off of exercise, and my coughing got really bad. So I ended up going to urgent care, and I had minor pneumonia. And I just had a viral bronchitis. So there wasn't really any antibiotics I could be put on, just to rest, warm liquids, really, really rest. And so that was really hard for me because I love to exercise. I love to move my body. And so I really took time off until I physically had no more symptoms, to ensure I'd be okay to come back to exercise. So I returned. I was cycling again, like normal. I didn't need an inhaler. I was just slowly getting back into it, and I think I cycled about 4 days that week and had no problem. And I was like, great, I'm back. I just felt a little weak because I was sick for 2, 3 weeks, and then on the fifth day of cycling that week, I had a heart attack while I was in class, and I had no idea. I just had stabbing pain in my diaphragm, so right between like my belly button and my chest in that area, and it kept getting worse when I tried to take deep breaths. And I was cycling at about 85% to 100% of my maximum. So I was breathing really hard. And then I struggled to breathe. And I was trying to diagnose myself really quickly and say, okay, is this because I haven't exercised? Is something going on that I'm not aware of? And so I didn't want to get up and leave class, because at that point I started hyperventilating because I couldn't get a deep breath. And so I said, okay, I'm going to wait here until class is over and somebody can help me off, and we can try and figure out what's going on. At that time, I also didn't know if anyone else had a medical background in the room, that if I were to get off the bike and fall, if somebody could save me. So I said, I'm going to stay on. So class ended. My partner helped me get off the bike, and I still was saying, I'm really struggling to breathe. I was checking my pulse in class, and obviously it was really high, which wasn't helping because I was like, okay, I'm exercising. Of course, my pulse is high. I don't really know what's going on. And I have no medical history of cardiac on either side of the family, by the way, like no history of anything. And so I go home, and the chest pains are still really bad. So I try and sit in the shower because I'm thinking, okay, maybe my lungs are still affected. And so I tried to get some steam in there and just take some deeper breaths slowly in the shower, and it didn't really help. And so I went to lay down and kind of just lay in fetal position, because closing my chest or contracting my chest felt a little bit better. I tried to fall asleep, and I heard a voice say, don't fall asleep, you might not wake up. And it happened twice, and it wasn't my voice. I, I have no idea whose it was. And I tried to roll over and fall asleep one more time. And when I rolled over onto my back, I like gasped for air. And that's when I told my partner, I think I need to go to the emergency room. I don't know what's happening. And I think it's beyond what I can help myself with. And so by the time he hopped in the shower, and it was maybe 10 minutes from when I told him we need to go. And luckily, St. Mark's is right, like within a mile of our place.
Yeah.
So he was able to take me there. And by the time we got to the ER, which was only like 10 minutes after I said this, I couldn't even talk. Walked into the ER, and my hands were on my knees, and I was literally hitting my chest trying to tell the nurse that I couldn't breathe, because I didn't know I was having a heart attack. And so they got me back right away. And I was really kind of going into shock because I had been in such discomfort. Um, And so they ran an EKG on me first, and I asked to see it because
You're like, I'm a
I
doctor.
wanted to know what was going on because I
Yeah.
didn't think it was my heart because previously I had bronchitis. That was more of a lung issue. And so my EKG came back normal. And so at first I thought, okay, this is good. My heart's okay. I don't know what's going on. And so it took me back for blood work. That ER visit ended up being almost 8 hours before I got admitted. And I really got nervous when they said I needed to get a CT scan to see if I had a pulmonary embolism.
Mm.
And when I came in, I could talk in very short bursts when I had a breath. And so I let them know about my background and that they could talk to me medically to tell me what's going on and
Yeah.
not beat
This is
around
a
the
great.
bush or something.
Yep.
And they said, okay, we're going to get you back to see if you have a pulmonary embolism. And my partner does not have a medical background. And he kind of saw me like start to freak out. And I wanted to cry, but I couldn't breathe. So crying would have obviously made me need to breathe harder. And he said, what's going on? I said, they're going to see if I have a blood clot in my lungs and it could go at any time and I could die. And I said that and he just stared at me. And that was when I was really scared because I had bronchitis. And so I thought, oh my gosh, what if it is something to do with my lungs? So there was like an hour of waiting before they could get me in for the CT. And then it took about an hour after the CT to get the results. And luckily, I didn't have a pulmonary embolism. So I was like, thank goodness. Because at that time when I'm waiting, I'm also like, if I do have one, it could rupture. And luckily, I'm in this facility and hopefully I can be taken care of. But that's terrifying
Yeah.
because what if I exercised and
You
made
know,
it worse?
when you're there, like you're in the
Yeah.
position of needing the support and you know so much. I imagine, like, not that
So
we don't
I,
know more, but knowing more probably, made you
it,
more petrified.
Oh, absolutely. Because, uh, and the doctor's coming in and telling me how certain variables in my blood results are increasing, which means I was actively, continuously having a heart attack while I was in there. And to give some perspective, they look at your troponin levels. And somebody who's having a major heart attack has troponin levels in the blood of about like 5,000, like massive amounts. I was in the hundreds range and it was continuing. So I was having a minor heart attack while I was in there. And so every couple hours they did my blood work and my troponin was still increasing. And so they kept telling me to try and remain calm, but I'm like, okay, I'm actively having a heart attack while I'm sitting here and I'm just waiting for, I don't know. So they ended up keeping me overnight. And that was a really weird 24, 48 hours of I'm a patient in a room that I once would come in and work with patients. And
Roles.
this is really surreal because days before I got a state award from the state of Utah and got invited to this big gala and I got voted best in education for the state. And it was just like this being
Mm.
seen. It was this first time of like me being seen post finishing school. And then I have a heart attack a couple days later. And so while I'm in there, I get an email that I was in the Provo Herald and here's this article about me. And the title was like doctoral student excels through rock bottoms. And I just start crying laughing while I'm in the hospital because I was just at a career high 2 days ago. And now I don't even know this is a rock bottom yet, but I'm like, this has got to be a rock bottom of my physical health. I've never endured a physical health problem, luckily and gratefully, besides sports injuries. And so
Yeah.
I'm laughing, and the nurse is like, are you okay? I'm like, absolutely not. I'm in the newspaper, but I'm here. Uh, and so that was that immediate experience, right, is forever stamped in my brain because it was so extreme and it's something I've never gone through before. And then I didn't even think about what would happen next. I just wanted to make sure I was okay. Uh, so that was May last year.
Yeah, and here we are. Yeah, February. So, yeah, March, a few months. We'll have to have a little celebration of your 1 year. Now you're healthy, whatever we can
Absolutely.
do to commemorate that. But what's interesting to me, and I'm sure there's people listening that think this too, I honestly thought when you have a heart attack, you just collapse. Like, I didn't think you could, like, yeah, distinguish if you want to get on the bike or off the bike. Like, I didn't realize that there's this yeah, that's what a heart attack can be or look like. So I just feel like I learned
Mm,
so much right now because I thought like, oh, your heart just does its heart attack thing and then you're, on the ground, or you just, I didn't realize that there's, yeah, like you could have awareness through that. And maybe someone listening has gone through that before or didn't know that either. Right. And I just think, yeah, that's super interesting, right? You're not just
mm,
attack and then done. It's like there's
yeah.
some things to maybe notice or pay attention to, or like you said, those voices are just an inner knowing of like, wait, I need to
Mm.
get checked out.
Absolutely. And I definitely want to echo or bold, underline that women have different symptomatic responses during a heart attack than men.
Okay.
And we've probably heard or been informed that, right? Maybe left arm tingling and chest pain is a typical sign of a heart attack, which it is. But in women, it may present very differently. It may be chest
Mm.
pain that's coming and going. It may be a shortness of breath. It may be all of a sudden, maybe a few days of extreme onset of tiredness. And so I definitely encourage people, because unfortunately you won't know until you know,
Mhm. And you
to
don't have
try
to,
and really check in with yourself, right?
yeah.
How are you physically feeling? How are
What are the levels called again? Sorry, I didn't mean to interrupt you. You said what's the T word
a
that you
troponin,
troponin, right? So you're not just gonna like feel off and want to go run and get your troponin levels checked all the time, right? It's like,
right?
how do you
Right.
know when it's time to, especially as a woman, like you said,
Yeah.
yeah, the symptoms are different than what you would expect, or like being tired. I would never think, oh, and not that we want people to think big things out of something that's not that big, but like I would never have known that. Never.
Mm-hmm. And it's also so important, and not to even stretch it as far as hypochondriac. In your journal, whether you journal or just make a note, if you notice just feeling weird one day, just write it down. It may be nothing, right? It may just be stress from work, or, where you're at in your menstrual cycle or whatever it is, but just make a note. If you feel like something's weird, or just write it down. Because once I was in there, once we figured out the diagnosis of having a minor heart attack, I had acute pericarditis, which is where the swelling of the lining around my heart filled with fluid. And I was obviously cycling really hard, and my heart couldn't keep up with the demand. But I had that resulted because the infection from the bronchitis went from my lungs to my heart, and no one knew. I didn't know. The doctors didn't know. They said this happens to less than 1% of people, and it's typically in people that are in their 20s and 30s that are really active because we're pushing our physical boundaries.
Mhm.
And so that once I got that information, I was like, this is really weird because something happened to me that no one would have expected. I would have never known. And some of the symptoms I did still have, like I mentioned, this sharp, sharp chest pain. And even the couple days before, I was really tired, but it was hard for me to ever think about it could be a heart attack because I was getting over being sick. I started cycling again. I just thought those were potential things that would happen when I'm getting back into it. And so when they were like, "Have you noticed any like tiredness or shortness of breath the last few days?" And I said, "Yes, but I don't know if it's correlational or causational because I was also sick." And so even just saying those things out loud to the physicians and the team that I was working with, I was like, "Oh, those are some things I kind of brushed off." Or,
Mm.
maybe I could have told my partner or told a friend of like, "Oh, that is really weird. I'm feeling like this today." Just kind of voicing it out loud or sharing it with somebody could really help to make sure that you're with someone or you're not alone during these times where you kind of feel off. Because what would have happened if I fell asleep? I have no idea. What would have happened if I didn't go to cycle that class and there were 40 people around me? Like, so, everything happens in the timing that it does for a reason, whether you understand it or not at that time, right? Hindsight or foresight. But I'm glad things happened the way they did and the timing that they did, because the rock, so to speak, that was dropped in the pond that day rippled. It's still rippling for me, but for probably 4 months after that, I was in a really dark place. And I have a lot of gratitude for that space that I was in. But wow, what a life experience to have a part of you physically die.
Mhm. Mm. And that's when I met you, was when we were in the teepee and you were like coming out of that dark
Yeah.
period. I was just talking about this because before you and I hopped on, I was on a one-on-one client call. And you said, everything happens for a reason. We might not be sure about it. I like to say things happen and we make a reason rather than
Mm,
everything happens for a reason, because these stories that we tell are so tight knit, right? In terms of
mm,
that. So what, like you said, when you look back, you kind of don't wish it didn't happen. Of course, in the moment, all the things, but like things happen and we make a reason. Why
mm,
did Kirsten have a heart attack?
mm. What a question. I think it's multifactorial for sure. But one is I needed to slow down. And whether that meant physically slowing down because I was trying to take on the world, or
Mm,
if that meant emotionally and mentally slowing down and checking in with myself because I became so good at being there for others and putting everything first. I still was in a really good place to put some of my needs there, but I still wasn't my main focus. And that experience had to happen for me to, one, truly love myself at rock bottom. I physically can't even walk up the stairs for months. I'm on bed rest. I am left with me. And I'm really glad that at that time I already had a really good meditative and journaling practice. But I really had to lean in and say, okay, what am I not seeing in my blind spot? What am I not practicing? What am I not dealing with that this experience is trying to show me? So that was a huge factor. And then, two, it was a weird culmination of my background has been preventive cardiology. And then I have a heart attack.
can't make
I,
it up. Wild.
yeah. And so I really, even not even an identity crisis, but I'm a very introspective person and thought maybe I'm not meant to work in this field anymore. Maybe this is the most symbolic sign that yes, I've endured school, I finished my PhD, I now have that in my pocket. What if I don't need to work in that field anymore? What if I can do anything with my life now and I've never had that privilege and that freedom? That this is just a brand new restart that I don't know I'm going to be really grateful for. Uh, and so those months were very heavy with a victim feeling, whether
Mm,
that is right or wrong isn't necessarily in the ballpark, but sitting with, okay, this has happened. This is happening for me. Why is this happening for me? Going through the periods of grief, of anger. Why did this happen for me? Going to the periods of sadness, like, why did this happen for me? Then entering the state of empowerment of, wow, why did this happen for me? Just that whole process, right? I would say I'm more on the latter end now of this power,
love that part.
but
You said the same thing, but you said it angry, sad, and empowered. And everybody listening felt it. I just got goosebumps over my whole body. And this is huge because this is the words change our world, right? It's like the
mm,
same but different, same but not. It's
right.
like the same sentence, but sometimes we need to ask that question or get things out from a space of anger and grief and sadness and then empowerment, right? And I love that you
Mm,
said about that victim, wanting to be in that space, and that it's not right or wrong, neither here nor there, right? We all need that for some amount of time, and we get to choose
mhm,
the duration of that. And when we choose to transition from victim and sadness and feeling, right? I don't think we should skip over that, but we get
right,
to decide how long do I want to be here? And then when is it time for me to move to that empowerment phase? And I just
right.
love hearing the nuances in your voice of, why did this happen to me? Why did this happen to me? Why did this happen to me? It was like
Absolutely.
epic.
And and then so that there's that level of internal conflict, internal talk, internal mindset with experience. And then there's that external. How do I tell people I had a heart attack? Do I want to tell people? Do I want to have those conversations? Do I have the bandwidth to have those conversations? Are people going to feel bad for me? Right. So then it's like this juggling of internal dialogue, external, how do I ask people to be here for me and support me? But I also don't want to project onto them and have them feel my pain because I'm aware that I will probably project if I'm not in a good place. So at that same time, when I was really going through this healing process, is when I kind of found Becca. and going to these different sound bath ceremonies and really leaning into my spiritual community, which has blossomed.
Mm-hmm.
And I was just in a state of like, this happened for me. I don't have all of the answers yet, but this is going to make me stronger as a healer, stronger as a leader, stronger as somebody who people come to for their health. And
Mm-hmm.
now I have a deeper layer to be able to relate to patients, whether I still work in cardiology or not, which I actually don't right now. Um, I can still relate to them on having something catastrophic happen to you out of nowhere. Even just that level of humanness, of empathy and compassion, of experiencing something you never thought you would.